Bipolar disorder, understanding highs and lows. Bipolar disorder is a mental illness that causes severe mood swings. People suffering from bipolar disorder swing between poles of emotional highs and lows. They are either extremely high or extremely low emotionally. Bipolar disorder also causes changes in their sleep, energy, thinking, and behavior. Bipolar disorder has severe effects on people's lives. Here are some of those effects. Emotional instability. Patients with bipolar disorder face emotional instability. They experience extreme fluctuations in mood. Sometimes, they become extremely happy and overly energized. At other times, they are extremely down and depressed. In between those periods, they usually feel normal. These euphoric and depressive episodes are common for these people. Complications in relationships. Bipolar disorder affects the daily life activities of its patients. Patients suffering from this disease face difficulties managing their relationships. As they are not able to control their emotional states, their behavior goes against the expectations of their relationships, and it causes complications between them. Disturbed professional life. The symptoms of this disease may also affect the patient's work performance. The extreme shifts of mood can make it very difficult for them to focus on their work and do their tasks efficiently. Financial strain. Bipolar disorder can lead to rash or impulsive decisions. This means that bipolar people may recklessly spend their fortunes during their episodes of mania. This can cause financial issues for them. Suicidal tendency. People suffering from bipolar disorder are more exposed to the risk of suicide. It is reported that every year, almost 12% of the suicides are committed by people suffering from bipolar disorder. Understanding the highs and lows. As previously mentioned, bipolar patients experience extreme highs and lows in their moods. Their suffering lies in these episodes of highs and lows. Let's take a closer look and try to understand them. Highs. This is one of the manic episodes of bipolar patients. During this state, the patients experience extreme emotional highs. They feel highly energized and elevated. This kind of manic episode has the following effects on people. Mood. During this period, the patients feel euphoric and experience a highly pleasant mood. You can relate to this mood with this example. Imagine you want something desperately and one day you achieve it. What would be your mood and feeling then? That feeling is somewhat similar to that of a bipolar patient. However, it is important to note that it can't match the intensity level or longevity that bipolar patients usually face. Racing thoughts. As these patients are highly energized during this period, they may experience a racing storm of thoughts that is difficult to manage and control. Risky behavior. As discussed before, bipolar patients are prone to risky behavior during this period. They may indulge in reckless spending, abuse, or even gambling. Grandiosity. During the period of mania, patients can have delusions of grandiosity. They feel superior and highly overestimate their abilities and talents. They may also experience delusions of having extraordinary or superpowers. Besides these things, they also have decreased sleep, increased activity levels, and impulsivity. Lows. On the other side of bipolar disorder are the lows that patients experience. This state of mania is the exact opposite of the other state, for example, highs. In this state, the patients experience episodes of extreme sadness, depression, and hopelessness. This may last for weeks or months. These episodes are also called depressive episodes. The patients may have the following symptoms during this period. Depressed mood. People suffering from bipolar disorder may feel sad and depressed for long periods of time. They may lose interest and pleasure in any activity they do, even the ones they used to enjoy before. Low energy. During this period, patients have extremely low levels of energy and face problems doing even the simplest of tasks. They may also lack the motivation to do anything at all and feel extremely tired. Negative thinking. Negative thinking is another symptom of this depressive period. The patients may develop a negative outlook on things. They can also indulge in self-criticism and unnecessary guilt. They may feel worthless and like a burden on others. All these thoughts and beliefs can lead to greater problems of hopelessness and suicidal thoughts. Changes in sleep and appetite. Sleep and appetite are seriously affected during this period. Patients suffer from disturbed sleep patterns as they have difficulty managing their sleep hours. They can also lose their appetite or experience an increase in appetite. Both of these scenarios result in a mismanaged diet that further affects their health. Conclusion: bipolar disorder is a severe mental illness. Its cycles of highs and lows seriously damage the well-being of a person. It puts them on a roller coaster of emotions, which is excruciating. However, it is not the end of the road for bipolar patients. With the right treatment and therapy, bipolar disorder and its highs and lows can be managed and put under control. Thank you for watching the video. Please like, share, and let us know your thoughts in comments box.